Hi, welcome to today's lecture. So, what do you think of when you hear the word health? What comes to your mind? Take a second, think about it. What is the picture that comes to your head? When you hear the word health? I'll tell you what picture comes to my mind. This broccoli. When I hear the word health, I think broccoli. I think greens. I think healthy eating. That's what I think. That's what I was told when I was little, that you need to eat broccoli to be healthy. And so that's exactly what I think of when I hear this word, is this picture. So I'm curious to know what other people think of. Actually, the word comes from an old English word that's actually hard to say. It's like more like heath, and it means whole, or the thing that complete in itself, or wholeness. Um, and so I think a lot of people think health as maybe a lot of different things. We think of nutrition or weight or the absence of disease. I think a lot of people think health that way. Illness is not healthy. But actually, health comes from this word, to be whole. And so I think really getting into this mindset as healthy as being wholeness, wellness, a sense of whole. So that's what we're really going to go off of this semester, is a sense of wholeness. Health in today's day and age, and your book has really begun to broaden to include these other types of aspects of wellness, thinking about emotional and mental wellness, intellectual wellness. How do we broaden our minds? How do we support those types of wellness? Spiritual wellness, um, social wellness. How do we support our social networks? Um, not necessarily online, but how do we support, our friendships and our families? Environmental wellness. How does the environment support us? How do we support our environment? As well as physical wellness. So, this idea of health and wholeness has expanded to include lots of different types of aspects, um, not only the absence of disease. So, what influences health? There are three main types of influences of health. There's environmental influences, and we can have different types of environmental influences. You can think of environment being like the environment that we breathe and we eat from, but we can also think of the environment that we are in. So our economic environment, or things that we have access to. Do we have access to the right kind of water? So, like Flint, Michigan, how does their water influence their health? How does access to certain types of food deserts? Some people live in food deserts, meaning they don't have access to proper types of produce, and that can influence their health and wholeness as well. Behavior is a really big influencer on our health and wholeness. What kind of activities do we do? As far as are we sedentary lifestyle? As well as, dangerous activities. Sometimes our work environment is dangerous, or even our leisure activities are dangerous. Even our day-to-day activities are dangerous. One of the most dangerous things we do day to day is driving our cars. Food is definitely a behavior that can influence, taking in certain types of food, and the different types of substances we take in, alcohol, tobacco, or even other types of substances. Genetics, of course, influences our health, especially certain types of diseases if we're predisposed to those types of diseases. So, how do we move forward in health? We can maximize our level of functioning, of energy and growth and abilities by avoiding types of risk factors. And risk factors are behaviors or conditions that increase your risk of developing a health problem, and incorporating healthy behaviors into lifestyles. This doesn't always mean that by avoiding risk factors, you won't uh, develop a certain disease or things like that, but it can help you avoid one. And incorporating healthy behaviors can help you stay away from certain risk factors as well. So that's what a lot of health experts and what we will help to unveil in this class as well. So how have we moved forward with health as a society? For a child born in 1900, life expectancy was 47 years of age, versus a child born today, life expectancy is 78.6 years of age. So we're living around 30 years more now than we were 120 years ago. So that's pretty good. We've done pretty well in about 120 years, made some good advances on life. And so, how have we moved forward as a society in the 20th century? What happened between those 120 years? Well, we've moved forward in vaccinations, uh, through public health, motor vehicle safety. We've gotten a lot safer in our motor vehicles through laws, plus like safety belts and airbags and things like that. Workplace safety. Certain places where people work were unsafe, and we've put a lot of things in place so that people would be safe at work, like helmets and harnesses and things like that. Um, Control of infectious diseases, although we're in a pandemic now, but we've put a lot of controls in for a lot of the infectious diseases that were running rampant before. And even though it kind of seems like we're not in control of it now, we would be in a worse situation were this 100 years ago. Reduce in cardiovascular disease and stroke deaths with some of our statin drugs, safe and healthy foods. We have a lot more antibiotics that go into some of our foods, and washing and being able to tell what's safe in our stores. We don't get a lot of botulism in our canned foods these days. Maternal and infant care is really, really good these days. We don't have as many maternal and infant deaths as we did 120 years ago. Family planning, fluoride in drinking water is good for our teeth and our bones. And recognition of tobacco as a health hazard was a really big step forward for cancer. So lots of advancements in the 20th century. Where do we go from here? So we moved so far. We were able to move our health to live more than 30 years. And what are our biggest leading causes in the US are heart disease, cancer, unintentional injuries, chronic lower respiratory diseases, that's like emphysema, and stroke. So this is some of the things we're trying to solve now. And some of the leading risk factors for these are tobacco use, inactivity or lack of exercise, poor diet, and alcohol use. So these are some of the really large risk factors that we're trying to combat as some of the big underlying health risks in today's society. So this is where we go as a public health society now. So going back to what is health, remember health is related to the word whole and wholeness. And in this course, we're really going to cover those big killers, the cardiac risk, the lower respiratory. We're going to cover invaders. We're going to cover addictions. Plus, we're going to talk about nutrition, mindfulness, wellness, and wholeness. So we're going to talk about it all, and I'm glad you're here for this journey, and I will see you next lecture.